Okay, so yes, so what you'll need to do either the psych eval, the initial one, which is titled Psychiatric Diagnostic Eval with Medical, which is that one. Yep. And then for your ongoing like follow up, they'll just be titled EM Established Patient. So they are exactly the same, to be honest, 100% the same. The only difference is this billing code or the title that says, diagnostic with eval, which is your first session. And then this established patient is just your follow-up kind of ongoing. Okay. Otherwise, they're exactly the same. Really no difference. When you do a follow-up though, the information from the previous session will pull forward and you can see what was talked about at the last session. So that's really handy. That's other than that is the only difference between the two of them. So I already saw your little flow chart with the, if this is an LTC and if this is Medicaid, then you do this. And if you're at a residential and then it's this, then you do this. So those flow charts, your supervisor will explain way more about those billing codes. I don't know other than those two.
Okay.
And that's what we're going to focus on today is your diagnostic eval, your initial, and then your follow-up is the established patient. We'll probably talk about that here in a second, but for now, just pull out either of these is fine, actually. Either one, because they're exactly the same. And then if you need it, if you feel like it'd be helpful to you, you can also have your mental status exam handy, or if you're comfortable with that, that's fine. Another thing, or you can use mine, is fine. We'll do a SNAP assessment as part of the eval. So if you want to have a SNAP assessment handy, okay. Yeah, or you can use mine too. Either way, it's fine. And if you want to take notes on it, you can have it. That's fine. So we'll start at your calendar. So remember, you go to the office tab in the middle, looks like a little office building. And then to your calendar. And you should have, when you were with Letitia the other day, you should have scheduled a diagnostic eval. What is your nursing? Okay, let's make one now because yours says nursing. We need one that says diagnostic eval. So go ahead and click anywhere on Tuesday or Wednesday. Any day in the past is fine. Yeah, new service entry. That's okay. So it looks like you had a nursing appointment. We'll just need to make a psych appointment. So your program would be whichever region you are with psych.
Well, I'm northeast. I'm going to be in some area, but for sure, I don't know where we go.
Okay, so let's just go with that for now. Northeast is fine. And then your procedure, you're going to want the procedure of diagnostic eval with medical, psychiatric, all the way at the bottom. Yeah, psychiatric diagnostic eval with medical. Yep, go ahead and choose that. For your location, honestly, for today, you can choose any location. This is just for pretend. And then you'll enter the time that we started. Really, this is just for practice. So anytime works. This is in the past. Yep.
Oh, I have to put a column, right?
Yes.
Yeah.
Okay. And then time out. Since this is in the past, we know exactly when you started and when you ended. If you were scheduling this for the future, you wouldn't know that. Right. So because this was in the past, we'll do a time in and a time out.
So 20 minutes?
Sure, that's fine. Yeah, for today it's just for practice. So any
47, 7, 07, 10, 07?
Sure. Yeah. Okay, so then your mode of delivery at the very bottom under custom fields, this is going to be face-to-face. So that should be good. Go ahead and save that upper right-hand corner. Yep. Okay, so your first step to doing a diagnostic eval or doing a follow-up appointment is to always have the appointment. I don't know about your facilities. Some facilities, the appointments are made for you by the scheduling department. Other times you'll be scheduling your own appointments. So check with Julie. I don't know which way it is. Sometimes it's one way, sometimes it's the other. So
yeah,
just be ready for either.
For me, because
okay.
I will be 30% in shame.
Okay.
Like I don't know, patients. to.
Okay.
That's
So
what
this
I'm saying.
appointment may already be made for
Mhm.
you, but it's always good to know how to make an appointment just in case you
Yeah.
have to see somebody that you weren't expecting or you have to make an adjustment. So you'll have an appointment either made for you or you will make the appointment. That's always the first step towards doing a psych eval or a follow-up appointment. To actually do the psych eval, then you'll click on the note tab next over from the
Okay, so I
service.
don't have to go back because I'm already here. I can just
Right.
go straight. Okay.
Exactly. Yeah. Okay. So it looks like for this one, you'll see that if it was a follow-up, whatever you talked about previously
Mhm.
would be in that gray box. And then you could update it with what you're talking about today, where it says like today's chief complaint. And you'll see that throughout the information from previous will pull forward. You can update it. If this is your first time, there is no previous session. So there won't be anything in the gray box. So you'll just choose either adult or child, one or the other, depending on who it is you're seeing.
Mhm.
And then we start with today's chief complaint, reason for the visit. So this is kind of what are they reporting today? What symptoms are they reporting? Have you done a lot of psych evals in the past?
I work in corrections.
Okay.
With inmates, so
Okay, so the reason I ask is most nurse practitioners I work with say this is very similar
yeah.
to other psych evals that they've done. So I was just curious if this looks like the format similar to other
Oh
ones that
yeah,
you've
like the
done.
format, like the chief complaint,
Yeah.
you know, pattern, yes.
Yeah, okay.
Mhm.
Okay, so chief complaint, you should, be fairly familiar with that.
Mhm.
Any homicidal, suicidal concerns, anxiety, panic attacks, increasing in frequency, decreasing in frequency, what's going on with that person that day, and kind of the reason for the visit.
Mhm.
If this is like the first time that you're meeting with them, you'll want to make a statement like evaluation or medication management. Other times you may
Mhm.
see somebody just to refer them to case management
Right.
and they may not be getting any kind of medicine from you at all. And so you would just maybe state reason for visit, recommending case management services. That happens quite frequently, where they may not ever see you again
Mhm.
until the next evaluation, but we're recommending them for TBS. We have way more nurse practitioners than we have therapists. So often it's quicker to get them in to see for a psych val than it would be to get them in for like a diagnostic assessment with a therapist. So if you want to follow along with your handout,
Oh, okay.
this is just kind of where we are. Today's chief complaint, complaining of whatever. You can add, health information background, 43-year-old resident of wherever, just kind of what's going on today with your client. Now, if this is a follow-up appointment and nothing has changed, she still has the same level of anxiety as she did last time, nothing has changed. You can click same as last visit. And then the information will pull forward from the previous session. Just kind of copy and paste it there if nothing has changed.
So if I click select same as last visit, I can still add a couple things there. I can still.
I think so. So I'm actually doing an update over here because I have a pretend client. So let me see. So same as last visit. The information pulls forward. Yeah, I could add it. I could add nursing services if I want. Yeah. Okay, so that's the first chief complaint section. And then under other notes, this is where you could, just add additional information that maybe doesn't relate to.
Where you at?
So scroll up just a little bit. Other notes.
Oh,
Yeah, other notes. So you might want to talk about her, her history. She's only been here because she had a car accident. She's learning to walk again. She's receiving, physical occupational therapy, just kind of other notes you could put there if it doesn't follow in line with, today's chief complaint or reason for visit. And then you can be more specific in the history of presenting illness, Sally, or in your case, Mary Beth. Mary Beth is a 23-year-old female resident of this facility. She reports depression, panic attacks. She's been prescribed Zoloft in the past, but is not currently prescribed anything for her mood. It's kind of history of presenting illness would go there. Then you want to indicate if you received information about this client from anybody else besides the client? If yes, you can click yes. If no, you can just click no. If you do get information from a guardian or from a family member, you could just indicate who that person was in the comment box. Also, if you reviewed Point Click Care, you can also put that information in there if you were able to consult that electronic information. Yeah, exactly.
Free from.
You got it.
Okay.
Yep. So past history, again, if this is the first time you're meeting with them, you're going to want to fill this out. If it's the second, third time, it may or may not have changed. So medical, psychiatric history, either reviewed with no changes or reviewed with changes, family history, same thing, social, substance, legal history. Do tell us, about the client's legal history or their family's legal history as well, if there is any. Just a quick little blurb about her socially. She's a single female who was living with her biological parents, who are her guardians, before she came to this facility to rehab after a serious car accident. Details like that would go in there. Then we get into medication. So side effects, if there are some, go ahead and click specify and you can fill them out in the box. If there are none, you can click none.
Okay.
If this is a review, whatever your plan was from the last session, we'll pull forward into plan from last visit. If this is your first time, there won't be anything there.
Okay.
But it's a good reminder of what you talked about last time, see if it's anything you need to follow up on from the last time, if this is like an ongoing client. For review of systems, certainly you're going to review psychiatric. And this is where you actually might get a template from Julie. And what might go in the comment box is almost like a little template to make sure that you review depression, to make sure you reviewed anxiety, mania, psychosis, dementia, PTSD, and then you could fill it in from there. So Julie is probably going to give you some additional things that I don't have. Perfect. You already know what I'm talking about. Very good.
And then I guess like Cassandra.
Yes,
I think when we are doing the documentation there, she wanted format to know more narrative than
Yeah, this is just kind of a prompt.
Yeah, so yeah,
That's
like
fine.
because it was like that on one of the cheat sheets, and they say, hey, make sure
Yes.
you remove that and
Yes.
it's more narrative.
Yeah, you got it. Yeah, that's just a prompt to make sure you cover them all. If it doesn't apply,
Okay.
you can take it off. That's fine. Or if you want to elaborate, please feel free to elaborate there. For allergies, I would say for the most part, nurses will be taking care of allergies for you. If you need to add an allergy, you certainly can. If they didn't tell the nurse and they told you, oh, I forgot to tell you I'm allergic to penicillin, you could click open allergy. And then over here is where you could add, if you needed to add an allergy, you could add them. So underneath where it says no known allergies, if you type in, or no, unclick that, and then if you type in like penicillin, you could add an allergy.
And then it will open up like suggestions. You add it. I think once you start like put 3 letters in and hit allergy, add allergy.
Is it suggesting?
Like that's what I was looking for.
Oh,
like,
it should. Hold on. If that's not working, we can try it a different way. So if you X out of that in the upper right hand.
that one though?
Yeah, that one. Yeah.
Oh, okay.
So let's go back to the client chart. Along the left-hand side, do you see allergies? Like a banner?
Oh, the banner. Okay.
Yeah. So if you just click the word allergies, there we go. This is where we can add if you need to add a new one.
Oh, okay. Where to
Do
know.
you have a little arrow button? No. That's weird. You should be able to type in.
Oh, no.
That's strange. Okay, we'll come back around to allergies. Most of the time nurses are doing allergies for you.
Right.
We'll look at that at the end. Oh,
Mm,
what did you click on?
I just went back there again and.
Oh, you clicked that one. Okay. We got through it. Okay, so yeah, if you type maybe an allergy.
Oh, maybe there, okay.
I think it's- Okay, just type in the whole word. Penicillin. And then if you click insert, there you go.
Oh,
There's the,
okay, so,
that's how you would it.
well, if you enter like at least 3 words, 3 letters.
Yes.
and then to this one.
Okay, so allergies, client allergies. I just want to make sure this is on the video for Letitia. We were struggling a little bit with allergies, but we got it. Okay, so allergy, maybe celery, I don't know, I'm just making this up. Insert. It'll suggest, oh, celery is on the list. Click OK. And then insert, we'll add it to the list. So I'm using a different client than you are. That's why my client has a bunch of allergies already.
It's kind of like,
And then, yeah, choose the one that you like. Click OK. And then you'll click insert.
So insert again.
Yeah, so just like,
Insert or search,
just like when Letitia was showing you how to make contacts,
Mhm.
you click insert and then you click save. That will then save it to the list. And then if you need to add another one, you can go back and add strawberries or whatever, you know, and then just keep the list going.
Do I still need like single? again?
Yes, anytime after you add a new item, you'll have to click save. Yep, you got it. Okay, so to get back to our note, it should be in your briefcase as an unsaved change for the service note. It should take us back to where we left. Might take a minute to process. Because mine is. Speaking of allergies, we have some allergies. Okay, so that's allergies. Like I said, 99% of the time, the nurse will take care of that for you. But just in case, that's how you would add it. And then it'll make a nice little list for you under allergies. Substance use history. Yeah, go ahead, scroll back down. Substance use history. Yeah, there you go. Yep, so if there is none, you can click none and call it a day. If there are some, you may specify by choosing it, and then you can list in the box more information. We do want to know about caffeine, so that's important. And even if it's just one cup of coffee a day, you would click caffeine and then list, Sally drinks several cups of coffee and several sodas daily, or whatever it is that person drinks or consumes for caffeine. For last menstrual period, again, don't assume that they don't get their period just because they're in a long-term care facility. They very well might, you never know. Then we get into strengths and barriers. So this is where you're going to want to have your SNAP assessment handy. Fill out strengths and abilities. Sally is friendly and outgoing. She has the ability to cook and bake following simple recipes or whatever. So yeah, preference. Your SNAP assessment, same thing for barriers and preferences. Maybe she's easily discouraged by what she considers to be slow progress. Her preferences are to meet privately and in the morning. So this is a good guide to get that conversation started. It's good to be specific here about what strengths, abilities, needs, and preferences are, because your nurse may be referencing this when they go to do the treatment plan. I mean, they can also have that conversation as well, but you do want to be person-centered and include that information. Okay, and then after that is vitals. So just like with allergies, your nurse should be entering vitals for you before you meet with the client, but just in case they hadn't, or if you want to see the vitals, yep, you can click on vitals. You can see what our entries that have been made. Now, I don't think your client has any, but I can show you what my client's flow sheet looks like. You would just click open vitals flow sheet. And then if you wanted to make a new entry, like maybe today, I don't know, maybe her weight has changed. We can make an entry about that. Maybe she wants to quit smoking or fill out whatever applies and then click save, just like with any other form that we use in SmartCare. And then if you need to go back, you should have unsaved changes in your briefcase if you need to get back to your note.
So after I enter the changes,
Yep, you'll click save.
oh, then go back to the briefcase again.
Yeah, so to get back to your note, it would be an unsaved change in your briefcase. And that will take you back to the note.
So every time I'm on a page, save it, go back to the briefcase to look up my current page. and
Yes,
then
because yeah, you're anything that has been worked on but hasn't been technically saved will hang out in your briefcase.
I
Or
have
unsaved
it on
changes.
the-
Yep. You got it. So those are vitals. And I think, yep, that's everything on this first general page. Any questions on that? That's, again, pretty similar to what you've seen before. Okay. All right. So then we go into mental status exam. MSC is the next tab over after general. And yeah, if you need your mental status exam, please feel free to reference that. I've seen it done different ways. If you like the text boxes, or excuse me, the check boxes, that's fine. But there's also an area at the end to sort of elaborate, explain anything that wasn't covered, or that doesn't fit into a checkbox. We certainly can do that.
Is this where we deviate like the BIMs?
The BIMs.
Yeah.
Yes, in the other comments. Yeah, that's one place to put it. And then there also is a whole other BIM section as well. But yeah, people will be looking for it there. That's fine. You can put it there. Sorry, I'm trying to get out of, I got into my flow sheet and now I can't get out of it. There we go. Okay, so mental status exam. Why is this not going away? I can't get rid of it. Like I'm clicked on mental status exam, but it's showing me the flow sheet. That's weird. Okay, I'll just keep going. So yeah, so mental status exam, if everything is the same, like if this is a follow-up, and everything is the same since the last time you met with the client, at the very top, you may just click all within normal limits, and it'll automatically select everything within normal limits for you. If you want to fill it out section by section, that's also fine. Either way is acceptable. Let's just talk for a second about the suicide, homicide, no suicidal concerns or present. So for each session that you meet with your client, you do want to ask, about homicidal, suicidal ideations, if they're having any, we want to do a safety plan. So Letitia should have shown you to do a safety plan. You would go to clinical documents and then put that safety plan, but you don't have to do that right now. That's just where you would do that. Just a reminder that if there is any, current suicidal ideation, so on and so forth, you'd be sure to do a safety plan. And then in the comment box, just sort of explain what are the thoughts, what is the intent, do they have the means with which to do it, sort of what is the plan going forward. The client should have a copy of their safety plan for them to reference. And you can make additional comments down there as far as who you consulted, how we're going to keep her safe going forward. And then, yes, I see you already filled out your little BIMS comment. That's something that could go in that box. And then at the very bottom, mental status exam, additional comments. This is also where you could perhaps summarize the GAD-7 or PHQ-9 or any other elaboration that you need to do down there. So I think that's pretty much everything under the mental status. Any questions on that? All right, so for medical decision-making, that's the next tab over. I have a note here that this is the most important area of the note to fill out. Go back to your note, the note tab. Right. No, right there. And then medical decision-making. There you go.
Oh, I click on it.
I think you did. Yeah, it's okay. So I have a note here that the medical decision-making tab is the most important area of your note to fill out. This is kind of where they're looking for justification for the amount of time that you billed or the services that you provided. You're going to want to add problems for what they're going to be treated for. A lot of this information is what the nurse or you will use to create the treatment plan. So they may be looking back here. A problem could be an actual diagnosis. So like listed here, problem number 1, major depressive disorder, recurrent episode, moderate. A problem could also be not a diagnosis. It could be like sleep hygiene or anger. So it's not formal diagnosis per se, but something you're going to work on in treatment and maybe even prescribe medication for. So it could be either an actual diagnosis or just what it sounds like, a problem. And then please list and explain, associated signs and symptoms. This will give you ideas on what to be addressed on the clinical treatment plan. This also helps the TBS, if you're recommending for case management, for them to know what to be looking for and what to be working on. So give information to those other people who may be working with your client, what you think treatment should be focusing on in the problem area. And you can have problem 1, 2, 3, 4, 5, however many problems you think you're going to be addressing in treatment is what goes there. Any questions on problems? Okay. All right. Then for data review, kind of just what it sounds like, you'll let us know, did you look at information, maybe point-click care, labs? Did you get information from the client? Who else did you talk to? And then you can summarize that information there. If this is an ongoing appointment or an ongoing client, the previous information, like you see there, will pull forward that you reviewed in the past, and then you can type in what you reviewed for this time. Definitely want to talk about any risks of complications or morbidity or mortality, over-the-counter drugs that are being prescribed. Prescription drug management maybe is an issue for your person, not so much in a facility, but other people may have trouble getting their medications on a regular basis. To client orders, I have a note to skip the client orders tab or the client orders section. If you scroll down a little bit more, client order, we don't use that function. So you will get training on SmartCare RX, which is the program that is related to SmartCare, just for you to prescribe meds, to stop meds, for those examples, but we don't provide any training on SmartCare RX. So that's what you would more be utilizing in those kind of situations. Same thing for medications. So what you'll see under medications, we'll pull forward for what you have entered in Smart Care RX. Sally is not currently prescribed anything, so she has nothing listed there. And again, either Cassie or Julie. Yeah, either Cassie or Julie will give you, Smart Care RX training, and we'll give you more information about this. Sometimes I've seen nurse practitioners enter medications that are prescribed by other prescribers in this area. I'll be honest, I don't know the rationale behind when they do and when they don't. They can tell you more about that, but you may see other prescribers listed here in some situations. So medications that they're reporting to you, self-reported medications, as well as discontinued medications will be listed there. Yes, so for the ORs, you want to pull it on every client being prescribed controlled medications, and when giving new prescriptions, even if the LTC doesn't do it, you should do this to make sure the client is not on other controlled medications, and then you would just list that information there. Okay, so then next section is activities completed. Some nurse practitioners bill based on time and others sort of bill based on complexity. And I'll be honest, I don't know the difference and I don't know how you determine that. That's something else that will come from Julie. So she may give you more details about how to fill out, time spent on the encounter, counseling activities. But if you do provide any of these services, educating on risk factors, discussed behavioral strategies, anything that is listed under there, you definitely would want to elaborate on what it was that you provided, as well as non-counseling activities, ordered labs, ordered medications, consults, would go in that area. And then again, the plan, we've already kind of talked about the plan. The one from the last visit, we'll pull forward here to remind you what was decided last time. If it's the same going forward, you can certainly click same as last visit. However, if things have changed, please update what is changed or what is new, what you're going to be doing going forward. So any questions on medical disability? Is that pretty similar also to what you've experienced in other positions? Okay.
The medical future goes on with that, with the balance sheet.
Yes, your flow sheet. Yes. Yep.
Yeah, Michael actually was pretty good at explaining that, so I was like, okay, understand.
Good. Okay, then the next tab is the aims. If everything you already know is going to be 0, you can choose default score to 0, and it will score everything down straight as zeros. If you need to, actually fill it out and give scores individually to each question, you can certainly do that. And then at the very bottom, questions about dental, dentures. So there is one embedded in the psych note. If you need to do one separately, for some reason, they're also under clinical documents. You would just click on aims if you just need to do like a one-off aims.
Okay.
But there is one in the psych eval. So any questions on aims? Okay. Diagnosis is the next tab. So if they have had maybe an assessment by a therapist, or if they've had other psych evals or other appointments with a nurse practitioner, you may see already some diagnosis that pull forward. If you agree with those, you can certainly just keep them. If you want to update it or change it, you certainly can. For example, if maybe you wanted to get rid of generalized anxiety disorder, like, oh no, they don't have generalized anxiety disorder. You could select it, and then next to it is that delete X. You don't have to do this on yours. I'll do it on mine. It'll ask you, do you really want to delete this record? You can say, okay. And remember, after everything we do, we always want to click save. And then if you wanted to add maybe an additional diagnosis or update their diagnosis list as soon as this processes, I'll show you. So you'll search for point 1. And after you've typed in the F code, a list will populate so you can be more specific even within generalized anxiety if you need to. So I'm going to actually give her that back.
Also like, it's my understanding, like if I go here under diagnosis and I see, you know, there's an area where the area is blank and like, the area may be blank with the patient's symptoms and you may be like awaiting for diagnosis. Am I on the right
You
side?
can do a rule out if you need to. Like an option might be rule out.
I'm so sorry. No,
No, you're
I'm
fine.
mistaken. No, that's actually a report from the long-term facility. Michael was showing me how they received a patient list and it showed like he said, okay, what I'm seeing this patient for, and it shows like an initial complaint, and they kind of put the nursing put like the complaint, but not like an accurate diagnosis. So it's
Okay.
like awaiting for I don't know where I saw that. I'm so sorry. I'm
No,
like
you're fine. So,
mixing.
so they will go through an intake process and the
That's
intake.
probably what it is.
Yeah, and the
That's probably
intake may
intake.
list kind of general symptoms, but
Uh-huh.
you're right, they haven't been formally diagnosed yet. That's what they're waiting for you for. So yeah, I haven't seen that report, but I know they go through intake and some basic symptoms maybe.
So like many
It's okay.
EMR programs and it's totally brand new for me. Never worked with Marquette
No, you're
before,
fine.
and I'm like, wait, what?
No, you're fine.
Okay.
But no, you're right.
Sorry.
That may be listed somewhere until they are able to meet with you and get a formal.
Yeah, like he would say, okay, ensure that when you see this in blank, that patient when you do your initial is awaiting for diagnosis. The primary diagnosis has to be specified, cannot be unspecified. The primary diagnosis cannot be dementia. That can be listed, but not as primary.
It's gotta be. Yep.
So there's like several. Okay.
Yep. No, you got it. You got it. You got it. Yep. To be eligible for our services, they have to have at least one F code, one mental health diagnosis. And then if you are referring them to TBS, if you want them to have case management, they need to have at least one Z code listed minimum. So like, threat of job loss, problems living in a residential institution. So they do need an F code and a Z code to be eligible for TBS. Okay. Yep. You got it. Any other questions on diagnosis? All right, so once that looks good, if you did, I don't know if this is something that you do, if you did engage the client in psychotherapy.
Productivity. Like if I'm short on my productivity,
Yeah, I know some do. I don't think all nurse practitioners do, but if you did, you would choose yes for psychotherapy, and when you choose yes, more boxes will populate. So then you can explain what was the problem that you addressed, what was your clinical impression, session summary, treatment plan, and recommendations. So just kind of fill out what was it that you talked about during psychotherapy. So this would be like an add-on code, like you said, to kind of get more productivity, interactive complexity, what time you started, what time you ended, I'm sorry, just what time you started. The unit is going to be one. It's always one unit of psychotherapy, if you want to think about it that way. You have there's only one option there, interactive complexity. And then whatever time, maybe we started at 11:15. And then it'll be one unit. Of psychotherapy. I think it has to be a minimum of 17 minutes. Yes, must be at least 17 minutes for psychotherapy. So if you're involved in that, that's how you would fill that out. And then yes, clinical recommendations. Here's another place where you'll see the BIMs. Feel free to put it in that other area as well. It can't hurt to put it twice. People also will be looking for it here. If you are referring to TBS, or if you're referring to nursing, This would either be your initial referral for those services, or you could reassess them on a yearly basis for those. And please be specific in your TBS recommendation so the case manager knows what you should be working on. So yes, refer or continue TBS, and then why. You want to be using the correct level of care. So you would state outpatient case management services are recommended. You want to use TBS and CPST. CPST is for phone calls. You want to be able to have that case manager bill for phone calls as well as case management. And then kind of some whys, to address and reduce symptoms of anxiety and depression, provide mental health education, coordinate care, advocacy, skill building, empowerment, as related to that client's mental health diagnosis and needs to improve their level of functioning. So your TBS, again, is going to be looking here for almost like a prescription. They need to have outpatient case management services, and then give them a little guidance. Why are you recommending it? What symptoms are to be addressed? And then similar for nursing, if you're recommending nursing services, you do the same thing. Yes, order mental health nursing, and then give us a little bit of why. Mental health nursing is recommended to check and monitor client vitals, handle emergencies, crisis, act as a liaison, educate on administration of medications and treatment, and provide follow-up testing as needed. So this is actually word for word what's in your medical treatment plan as to the interventions that nurses provide for nursing services. So that's kind of where I got that from. If it's going to be any different, you can specify sort of some guidance for the nurse. What should they be doing with this client? What should they be focusing on? So they know when they go to do the treatment plan, what to put on it. So we haven't filled this out. It's not going to let you sign it, but you would, click sign just like you did with any other documents that you did with Letitia. And then at that point, it will go through an activities-based calculation to perhaps recommend if you should bill versus time, if you should bill versus complexity, if it thinks it should be higher or lower. You'll click on module, and it will show what you've selected. So we haven't done this, so it's not going to show it to you. Let me see if it will let me do it. It might not. I don't know if I filled mine out all the way. Oh, I did. Okay. So yeah, this is what I'm talking about. It kind of looks and kind of skims through your note, and it will suggest what you should bill for. Let's see what mine tells me. So maybe based on things that I've typed in, or maybe the diagnosis, it's suggesting a different billing code. This is an existing patient. Total time was 26 minutes. Let's see what it tells me. Oh, okay. If it looks okay, the signature page will come up and you'll sign it. Just like you did with anything else that you did with Letitia, you'll type in your password to SmartCare. You'll click sign. It'll turn it into a PDF type format, and then you're done with that assessment after you've signed it. Now, I don't actually want to sign this because I need this as my example. So I'm going to cancel, but you would actually go ahead and sign it once you're all done with it. So any questions on anything really in the psych note? The same exact situation for a follow-up appointment. You could just choose in a lot of areas. If it's the same information, just click, same as last visit and move on. Just coming from like a case manager therapy standpoint, don't be afraid to be very clear with what you want TBS to work on, what you want nurses to work on. They're also looking at that BIM score, so they'll be looking for that. And then other than that, as far as more like medical things, Cassie or Julie will give you more guidance. I'm just here to show you how to fill out SmartCare and a couple, pieces of information that we're looking for from like a QA standpoint. Here's like eval. Questions? Okay. All right. Well, thank you.